Did you know heart disease is Australia's biggest killer? At the Hospital Research Foundation, with our charity Australian Heart Research, we're determined to beat heart disease. Our team wanted to learn more about heart health, and so we asked an expert.
My name's John Beltrame. I'm the Michelle Professor of Medicine at the University of Adelaide, a cardiologist working both at the Royal Adelaide Hospital and Queen Elizabeth Hospital, and also the Director of Research at those two hospitals.
What is heart disease?
Consider the heart as an engine of a car. Things can go wrong sort of at the manufacturing level before it comes out of the factory. Things can go wrong with the engine block or the workhorse, the heart's a big pump. Things can go wrong with the electronics, and then things can go wrong with the fuel lines, or in the heart's situation, the blood vessels. And as it happens in cardiology, we have subspecialties that address manufacturing problems, electrical problems, pump problems, and fuel line problems.
John, what causes a heart attack?
Well, the most common cause of a heart attack is when one of the three major arteries in your heart becomes blocked up. What happens in the human heart is it breaks up into smaller and smaller blood vessels. And so the big blood vessels are, for example, about 4 or 5 millimetres in diameter, whereas the microscopic ones are less than 0.1 of a millimetre. And so we can't see those. And when they go wrong, they can give you exactly the same problems, and yet we can't actually see them. So by measuring, if you like, the pressure in the fuel lines and that, we can work out what's actually going on there and what's wrong with these people, and then try and correct that, which is somewhat challenging, but that's a lot of the research work that we're doing.
As a male, am I more likely to suffer a heart attack?
So it depends the sort of heart attack, because 90% of heart attacks that we see, it's due to a blockage in the big arteries, and about 10% there's no blockages in the big arteries. Now, if you're a male, you're much more likely to have a blockage in the big artery, so that 75% of males, you will find a blockage in the big artery. But when it comes to the women who have heart attacks, half of them you find no blockage at all, and so there's a different problem occurring, and this gets back to the microscopic blood vessels I was talking about.
How do I maintain a healthy heart?
If your cholesterol's too high, so again, watching the food that you eat. Smoking is a no-no, because that is one of the biggest causes of heart disease that we need to reduce. Looking at sugar, because people who've got diabetes are much higher risk of having heart disease. That also then relates to weight. So they're probably some of the key factors to reduce the risk of getting heart disease.
Is heart disease hereditary?
Good question, and it depends on the type of heart disease. There's some heart disorders that there's a very strong genetic component. For example, one particular heart condition, in someone who's affected, 1 in 2 of their offspring may also have the heart condition. And now we have genetic testing to look for if any of the offspring are affected by that condition. However, there's other forms of heart disease where genetics plays a less significant role, and in those it's the classic argument of nature versus nurture, that it's a combination of the genetics you've got plus the environment you're exposed to.
Can people live a normal life if they've got heart disease?
Absolutely. Certainly some people that are very severely disabled by their heart disease, they will have some difficulties. But generally, particularly after many of the heart attacks, people can look towards having a good life, and certainly should remain active in that.